So for a family that has been told, or that want to do the diet, but have been told by their neurologist that they should not try it, that it's not going to work, they should go to a neurologist that has used the diet before, to a center. Or if they don't know of a center close by, then they can find one through the Charlie Foundation, or through Matthew's Friends, or through any other email resources that are available now. And come for that second opinion to hear truly what their options are.
Parents need to be proactive. And I think doctors are becoming more willing now in this internet era to look at that data and say, you know, maybe I'm not as familiar, but I'll get back to you. And if they're not familiar or they don't offer the ketogenic diet, it is crucial that they refer. And I think it's up to parents to say, look, this is what I would like to do. Please, can you refer me or give me some names of someone who would do the diet? Someone close to me, hopefully, but if not, they may have to travel a distance.
When we meet several kids who come to us for consultation, the parents have heard about the ketogenic diet, and the parents have really had a strong interest in trying it. And oftentimes parents tell us stories that they have really tried to be convinced otherwise, either told that it won't work, their child won't tolerate it. So my advice to parents who have a strong feeling about a treatment option for their child is to be that child's advocate. And if their neurologist doesn't feel comfortable or doesn't think it would be useful, to try and find resources that could help direct them, either by contacting Charlie Foundation or Matthew's Friends, or looking for centers that do have a diet program.
For the most part, I think a patient should not, with his or her own family, feel constrained by feeling that they don't have any options. We have different ways of getting information, and people should be more aggressive, I think, in many ways, to try to find out that information and to seek a center that would be willing to evaluate their child and to go after the ketogenic diet treatment, properly speaking.
My advice to a parent that has a child with epilepsy that's getting resistance to going on the diet would be go elsewhere. Ask for a referral to another person that would be more interested in the diet, to a center that has expertise in the diet. I wouldn't sit there passively and say, okay. I mean, I'd be, the term everyone's using nowadays is proactive, and I think it's a good term, that they should be forceful in their desire to do that. Try to get a clear explanation why the physician and his team does not want to start the diet. But I think if the answer is still no and it doesn't make sense to the parents, I think certainly they should seek another opinion.
So for the family that doesn't have a local doctor who's either wants to do the diet or can do the diet, I usually suggest they go to a center. In the modern era, with the ability to obtain diet plans transmitted by email, to have electronic follow-up, it's easier to follow patients at a distance than it used to be in even 5 or 10 years ago, where it was just hard to do that and to manage the details of the diet. Nowadays, it's really pretty doable with intermittent follow-up.
I think it's very difficult when parents are dissuaded from doing the diet to really know how to move forward. I think it depends who has done the dissuading and to what degree assessment has been made as to whether the diet may be suitable. As from a UK perspective, I think much of the dissuasion is done on the basis of a lack of knowledge about what the diet really entails, and whether the diet, a lack of knowledge base about whether the diet really is the way to go forward and the way that it could be of benefit. There are still quite a lot of older beliefs that it's not going to be effective, that it's very difficult to administer, and it's going to be too difficult for families, let alone the physicians and dietitians that need to do the caring for them. I think if, in that scenario, and that the way it moves forward in the UK is that parents are pushing for a second opinion, and they're perfectly within their rights to ask for a further opinion. And that's the only way we can advise them to go at the present time.
What's really important is if we have an effective therapy for an epilepsy syndrome where we don't have established effective drug therapies and that child is intractable to medication, it makes sense to me to use the diet as early as possible if that is going to be the effective therapy, because we know that ongoing intractable seizures are going to have cognitive and developmental costs for that child. So I think if you're a parent and you really feel that, as a parent you're your child's best advocate, If you feel that your child would benefit from the ketogenic diet, I would really encourage you to seek assessment at an established ketogenic diet center and have your child evaluated there.
And I think if a parent kind of approaches it in that kind of a fashion, saying thank you for all you've done, because I think most people have really worked very hard, but we need to continue to open this up. And we're not going off into, you know, some East Elsewhere, you know, herbalist shop, if you would, okay? We're going to a center that's gotten, you know, proved their ability to do this. And I think if parents, I think are educated, prepared to make that kind of a statement to their practitioner, I suspect the vast majority of practitioners would respect it and respect what a parent is doing. And I guess the bottom line is if a practitioner doesn't respect that, then you know what? You should get yourself another practitioner anyway.